Pregnancy should be a joyful time in a woman's life. But for women in rural Ethiopia, it is a time for grave concern. 1 out of every 27 women in Ethiopia dies in childbirth. Many others suffer devastating internal injuries due to a lack of medical care. Most of these childbirth injuries are caused by protracted labor in situations where no trained professionals are present to help. One of the most physically and psychologically traumatizing of these injuries is an obstetric fistula, a hole between the birth canal and the bladder or the rectum. It's caused by prolonged obstructed labor that usually ends in stillbirth. Women with fistula are often rejected by their communities and live isolated and alone. But childbirth injuries such as fistula can be treated, and they can be prevented. Hamlin Fistula Ethiopia has been at the forefront of these efforts for more than 4 decades. In 1974, doctors Catherine and Reginald Hamlin opened a hospital in the Ethiopian capital, Addis Ababa, dedicated to treating women with fistula. Today, their legacy endures. Almost all fistulas and other childbirth injuries can be surgically repaired. With a surgical success rate of more than 90%, Hamlin's primary hospital in Addis Ababa has become a global center for fistula treatment, rehabilitation, training, and prevention. Outside the capital, a network of regional care centers offers surgeries for fistula and other childbirth injuries, as well as cesarean sections and other maternal health care services. Because fistula can be both physically and psychologically devastating, Hamlin offers holistic care designed to restore a woman's body and her spirit. Patients are provided with medical care, counseling, and life skills such as literacy classes to help them regain joy and self-worth. The key to preventing childbirth injuries is greater access to trained health professionals. That's why Hamlin opened a midwifery college in 2007. The Hamlin College of Midwives helps address the critical shortage of maternal health care providers, particularly in the country's most remote regions. Students are chosen from rural villages and awarded full scholarships to attend the college. In return, they agree to work for a period of time after graduation as a midwife at a rural health clinic near their home. From local health workers to international surgeons, Hamlin also trains current medical professionals to expand the number of clinicians who can treat childbirth injuries and recognize the early warning signs. For more than 4 decades, Hamlin Fistula Ethiopia has pioneered efforts to save the lives of women who suffer childbirth injuries and to stop these injuries from occurring in the first place. Today, we are saving the lives and restoring the dignity of women across Ethiopia. Join us in helping make pregnancy not a time of peril for some women, but a time of joy for all.